Dr. Robert Grupe is the author of The Change, a textbook for guided corporate transformation, and Creating the Future, containing his most requested radio commentaries. Featured in Who's Who in America, he has given keynote presentations at Oklahoma City University, the University of Central Oklahoma, and Oklahoma State University, among others. For 6 years, he hosted the television program Creating the Future on Cox Cable. A father with 4 children, all served by the Oklahoma City educational system, Dr. Grupe has a personal and abiding interest in the work of the Oklahoma City Educational Television Consortium.
Opportunities in the healthcare profession have never been more marketable. We want to look at several health career training programs and how they can jumpstart success in the healthcare profession. And to do that, we're going to start out with Nancy Sweet-Fitzgibbon from OCCC. And Nancy is the director of the Anesthesia Technology Program. And Nancy, we've talked earlier before about the certification, and there's a lot of value that can be gotten for somebody wanting to enhance their career with it.
Absolutely. Anesthesia technologist is a certification requiring an associate's degree education, because what they do in the operating room, what they do in the ICU, what they do in the emergency room, wherever they are, is instrumental in providing the safest, most cost-effective, most timely care for a patient who's in distress. Anesthesia technologists learn about anatomy and physiology, pathophysiology. When one is under anesthesia, one can't move. And what they also learn about is positioning, so that all your nerves, say you're having your foot surgery because you broke it, you're laying there flat, and they learn how to pad exactly where. One of the chief times that I personally have, as a nurse anesthetist, have benefited from an anesthesia technologist who is well trained is in a trauma, because we have a lot of traumas in the Oklahoma area on occasion, and they are right there. They know how to make the equipment work, and I take care of the patient. They make sure the equipment works. We work together to make safe care.
And you have so many variables that constantly come up. New equipment, the way new equipment. Let's talk about that for a minute.
New equipment. They're the ones, new equipment. It's an interesting thing that when I show up at work, maybe I'll have a new anesthesia machine, or maybe there'll be a new monitor, or there'll be what has saved lives over in Afghanistan is what's a blood transfusion equipment. I'm going, looks great, I understand the dynamics, but how does it work? And that's where the anesthesia technologist is trained by the manufacturer to get it ready for me, to troubleshoot it, to be able to hook it up to the patient, and I continue monitoring the patient while they're doing everything. I go, that's broken, fix it, and magic happens and they fix it.
So literally, through this technology program, they're learning to be repair people. That sounds kind of basic, but...
Oh, yeah. And repair of the anesthesia machine. They also they learn how to think ahead. Like I'll say, I think I have a difficult airway. And they'll go, oh, I will get, in their head, I'm going to go get the difficult airway card. I'm going to get this piece of equipment, this piece of equipment. This. Not only are they going to get it, but they know how to take care of it. They know how to set it up. And because we all like clean things in it, they know how to clean it properly, sterilize it. And they are also part of the cost effectiveness, because they know what can be recycled, what needs to be cleaned which way, and how to do it effectively, because we don't want to contaminate the next patient with equipment that hasn't been cleaned properly.
And all of this, in some cases, has to be done very quickly.
Yes, sir.
Some examples of that.
Equipment. Just the other day, trauma was done, and says, okay, turnover, because there's someone down in the emergency room, and they come in kind of magic. They come in, they move all the dirty side, I won't get graphic, but all the stuff with this red substance that comes out of bodies on occasion. They clean that all off, make sure it's clean, and then they set it up, and you walk in 10 minutes later, and you've got 5 different kinds of IV access, all the machine is right away, everything's restocked, and you're ready to go again.
let's talk for a minute about the structure of these programs. How long are they? What are the qualifications?
Well, to optimize success, the OCCC program requires a year of prerequisites, and that would be your anatomy and physiology, your chemistry, your how to speak, because these people will be supervisors very soon after graduation.
Are you saying the soft skills come into play with this?
Oh, the soft skills. You mean being able to handle an environment with everybody yelling at you?
Yes.
And you go, no problem, I've got it. Yep, I'll go take care of it. I'll be there right there. They learn in our classes, we actually take that beginning psychology and how to get along with people, and we apply it. We do a lot of scenarios. Going, okay, where is your scope of practice? How can you tell someone who's very stressed, like a surgeon or especially an anesthesiologist who's having difficulty getting an airway, sir, I can help you. And you keep your calm so everybody in the room stays calm. And that's a big part of being in healthcare.
What you just touched on, that, people think of the technical aspect
Yes.
of this, but yet we're talking about something relating to communication skills that can be most essential at times.
Everybody, it's a team, and that the operating room is a team. Every single person is there. It's not a team where it's like baseball. We have our section, they have their section, but the patient is the focus. And so teaching the anesthesia technologist how to focus on the patient by assisting it's a dance, because they need to be thinking ahead, but they also need to be right in the moment.
So it requires not silos, but intercommunication.
Yes.
Very, very much so. Now, I'm looking at something here called the National Certification Examination.
Yes.
How does that come into play?
The Association, the American Society of Anesthesia Technologists require an associate's degree prior to be sitting for their technologist certification. So once they have done all the clinical aspect and all the laboratory requirements and the didactic, they can sit for this exam. So our program gets them ready to facilitate anesthesia and also pass the certification. Once they're certified, they can command excellent salaries, because across the nation, it is a recognition of a certain level of skill, experience, and knowledge that every single person understands what they have and what they can do.
From the time that they start this program, about what is the length of time to the point where they can take that certification exam?
The program is designed, if you can go full-time, 2 years. You start in a fall, you do your prerequisites, you apply, you start that summer. Our actual anesthesia core programs are from summer of 1 year to May of the next year. And as soon as they graduate, they can sit for boards.
Now, I notice you have here a combination of online and campus.
Yes.
How does that coordinate? How does that work?
The whole idea of this, stemming from the design when we first initiated it, was taking into consideration most individuals who go to a community college need to work. So their didactic, their theory is online. When we say online, it's not boring, just click through things. There's interactions, there's problem solving, there's group activities. Then they come to OCCC's state-of-the-art simulation center. It's amazing.
I like that emphasis.
Oh, it's amazing. It's as good as any anesthesia provider training center. They come there, they practice on the simulators, then they go and they work as an anesthesia technologist for the residents down at OU's training center, and then they go to clinicals all over the metro area, primarily at OU Health Science Center currently, but we're wanting to expand so that we can really take advantage of all the educational experiences in the state.
So they are going to be in real-life situations.
They have to. In order to sit for boards, they have to have, I think it's 600 300 cases, 600 hours of exposure, either simulated or actual cases.
And they can get this over a 2-year period?
Yes, sir. I did the numbers, and I've worked very hard. They'll go lab one day, clinical one day, and their clinicals will be 10-hour shifts. So, but if you add up all the numbers, it's a lot of work.
How would you put this from the standpoint of age, or not necessarily geographics, but younger people who have already been in a profession, who are wanting to just move into another profession? You have a percentage, I guess.
I don't have a percentage, but I can give you anecdotally what I've seen both from where I've worked and what I see in the applicant pool. They are all over the map. And because it's such a technological, a hands-on repair person or maintenance person, what's fun is that you get more men in it as well, healthcare-wise, and so it goes across the spectrum of gender, it goes across the spectrum of age. You'll have people that have been applying that have a master's degree, but they didn't like being in health policy. They wanted to be next to the patient. People that thought they were going to be a nurse, and then they decided, I'm more of a technological person. I don't want to necessarily do that hands-on. I want to do hands-on, but I want one step back.
So if you were to look at the age range, about from what to what age?
I'd say new grad, straight out of high school into your 40s, because it pays well. It's a 2-year investment, and you get a new skill set. One of the nice things is those older students have the experience that sets them up for success as a supervisor. Because this is new in Oklahoma, it's not new in the country to be certified technologists, but new in Oklahoma. When you graduate from OCCC, hospitals will expect you to rise to the level of at least team leader.
So it is something that's been going now for how long?
25 years across the country. It started in California and New York, those kind of areas. The certification has been around for about 15 years. The requirement for at least an associate's degree has been around for 3.
And how long has this particular program been running?
It has its inaugural class this June.
All right, so it's rolling.
It is rolling. It is rolling.
Now,
it is moving quickly.
How often can an individual get into this stream of this?
Once a year. Applications are due in February, announcement of the classes in April, and then class starts summer semester and runs to May.
And how did you become so excited about this?
I love the people I work with. These anesthesia technologists, the anesthesia techs where I work at OU as a nurse anesthetist are like my children. I want them to, and they're all ages, but I want them to do well. I see how smart they are, how hard they work. I want them to get the recognition and the money. They should be paid well for how hard they work and what a difference they make in a patient's care. And so doing this program facilitates that for them.
And this is another example of how education is shifting. The marketability here is enormous.
Yes, yes.
The need for health care in the future is
it's not going to get any smaller.
No. And over a 2-year period, that's a wonderful investment.
Very, very small investment, yeah, for a lifetime of taking care of patients.
Nancy, thank you so much. Nancy Sweet-Fitzgibbon, Director, Anesthesia Technology Program at OCCC. We'll have to check in with you again soon.
That would be wonderful.
Thank you.
Thank you.
Metro Technology Center offers full-time training programs. Most people don't know, they don't realize that they also have short-term programs that can be of real value. And with me is Lou Woods, who is the instructional coordinator for health courses, and a student, Keisha Anglin, with Metro Tech. And Lou, let's talk about these short-term courses.
Okay. We have a variety of short-term courses ranging from 4 hours to 206 hours that students could take to climb that career ladder.
That's quite a variation.
Yes, it is.
That is. And how does that sort out? How do you get the word out, and what's the best way for a student to decide on that?
Well, they can always do a web search. We send out thousands of catalogs twice a year that goes to Oklahoma City residents that shows every class, not only medical, but all kinds of short-term classes that Metro Tech offers.
And so if I ask you what short-term courses do you have a lot.
Yes, we have a great deal.
And they cover, what, a wide variety of areas?
Right. Everything from engine repair to medical, CPR, computer skills, child care, veterinary aid, where we have a veterinarian that comes and teaches.
Well, let's talk cost. Everybody these days have to watch their dollars.
Yes.
If they're coming back in to go through some of the short-term courses, what are some of the cost variations?
Well, we're a non-for-profit school, so we try to keep our costs down so that we can serve more people. So a short class, like a 4.5-hour CPR class, is $45, and that includes their card from the American Heart Association. Other classes might be 108 hours, a certified nurse aide class. That's $505, 18 days if you went in the daytime.
So there's quite a variation,
right,
which is needed. This is a silly question. Are jobs in the health field in high demand?
Yes, they are. We even have recruiters from industry come and speak to a lot of our classes the last day of class, trying to get new employees because there's such a demand.
Keisha, tell us about your life experiences at Metro Tech.
Well, I started at Metro Tech just taking the basic computer classes, Excel classes, Word classes, and then my uncle got sick and he was diagnosed with dementia, and I wanted to help take care of him with my aunt because they raised me. And so once I started pursuing the career of taking care of him, I went to Metro Tech and I took their CNA class. And I love that so much. I enrolled into their home health aid class, and now I'm enrolled into their AUA class, and soon to enroll into their LPN class. So just because of that one incident, I've just changed my whole lifestyle and career.
Well, that wasn't necessarily at one point intended to happen.
Right.
But what do you think about the healthcare field now that you're getting into it?
I absolutely love it. Since I've been attending classes at Metro Tech, I have been hired at a hospital, and I work there 3 nights a week, and I absolutely love the job that I do.
You do realize
Yes.
that as you finish all this training, they're going to be waiting for you and looking for
Oh,
you to
yeah.
hire you.
Already. Absolutely.
And that's a wonderful thing to know, is that you're going to be in a highly marketable area. So what is your long-term vision?
To be a registered nurse.
When are you going to be that?
Soon, hopefully. Soon. I'm working up that career ladder as we go. So because I still have to work, and, you know, with Metro Tech offering such a flexible schedule, I'm able to take my classes during the day and work at night. So that really helps. It might take me a little longer, but it's definitely something guaranteed.
So you like the flexibility of
Absolutely.
the classes. You like the facility. What about the education that you're getting? What do you like about the way that it's provided to you through Metro Tech?
I think they hire excellent teachers there. They're very educated and they know exactly what they're doing. Those classes are not just easy fly-by-night classes. They really get in depth of what you need to know. So when you go out into the field that you want to go into, you definitely are prepared and know what you're getting into.
And that's heavy duty.
Absolutely.
Because it's coming from a student.
Yes.
But going back to you, Lou, how did you get into the healthcare field to be doing what you're doing now in education?
Most of my career has been education. Even when I was in public school, I thought, I want to be a teacher. And so I took a career tech course on childcare. And then when I graduated, I decided I wanted to be a nurse. And so I just started climbing the career ladder. And most of my career has been in education, in the medical field. So I'm educating people in the medical field.
Another question here, what are some of the average salaries of folks who go through your programs?
Depends on the program they take. Usually, if you're a certified nurse aide, the salary range can be $8 to $12 an hour, and that's with only 108 hours of training. You can wait 6 months and take another class called a certified medication aide, and then you'll be able to pass medication in the nursing home, and their wage is about $13 to $14 an hour. And then Keisha's taken the AUA, and they're trained to work in the hospital to do mainly sterile technique.
Absolutely.
And I think their salary starts at about $15 an hour.
So the path just moves up.
Up, yes.
As you go with what some people would say are, short term but very comprehensive courses.
Mm-hmm.
Wow. And like we were saying, this is the future. The healthcare field is not going to be filled anytime soon.
It's not going away.
No. And you were telling me where you work now.
Yes.
And are you finding that your training has really helped you to fit in to that?
Oh, yes, absolutely. I've learned so much at class, and so when I go back to work, I'm so eager to tell the nurse what I learned and say, I learned this today, and I can't wait to be able to do that. And they're really excited for me to come aboard once I finish this class and get my certification so I can go ahead and start. They have some really good nurses there.
I can tell that you're excited.
I am. I'm really excited.
I can tell that you are very excited. And Lou, maybe you could share with us one or two success stories of people who've gone through maybe one of the shorter term classes and how it's really helped to redirect and help their lives.
Right. Sometimes we get disadvantaged students that's had a rough start and they feel knocked down, and for whatever reason they decide to take these classes. They start out slow, and we always tell them, don't let anyone determine your destiny but you. Don't let people stop you. And to see these men and women that take these classes and get hired at a comfortable salary and then come back for more, that blesses us, because now they've entered the healthcare field and they are helping people, but also they're benefiting themselves and their families. That's exciting for us.
So you see self-esteem being lifted up with these individuals.
Yes. And we also get people that they want preference points for RN school or LPN school, so they take these little short-term classes as preference points to get into these high-demand schools.
Yeah.
And something else which is a part of the whole package, from these courses, and many of them are health-related, do the end points, the hospitals, the other facilities help to shape and mold some of these so that you've got the right equipment and the right training to to move these folks right out into the real world.
Right. We've had industry come in and advise us. We go to industry and see what the demand is or the new techniques so that we stay current.
And what about equipment? Aren't we in a day and age where it's like new equipment comes out all the time?
All the time, right. We do try to stay on top of that. In fact, for our CPR classes, we're in the process of ordering all new mannequins that's monitored. And so we are innovative, and we try to have the latest equipment for our students.
What does the future look like? What are some things that are coming up, Lou, on the horizon?
For new classes?
Or new classes, or just, sure, just address it as you would there.
Well, one thing that we have started addressing is the Alzheimer's epidemic. There's 5.1 million people that have Alzheimer's, the beginning of Alzheimer's. So we've invested in training for 2 national certifications so that people that work in the healthcare field, especially if they work with people with dementia, they'll be better able to understand how to approach these people in the different conditions that they might be expressing. So we've had also mental health training. So we are looking at other things like that for additional training for our community.
So you may be expanding.
Right. In the nursing homes, we have several nursing homes that are sending their employees for the dementia training.
It appears really that the needs are almost endless.
Yes.
As we look at the different areas of society. And I'm looking here, for example, at some of the short-term courses being licensed practical nursing, radiological technology, medical assistance, surgical technology. Yeah. These require very special training.
Yes, those are actually full-time. Usually the surge tech and the LPN is 10 to 11 months, and the radiology technology is 1.5 years. But still, with radiology technology, you are trained to go work in the hospital and take x-rays.
Well, and what you said is true. I think what I was thinking here is the short-term courses lead up to those full-time courses. And I guess they give the prerequisites in many cases that are necessary to go into the full-time courses.
Right. And at MetroTech, if you take some of our short-term classes and are successful, then you get preference points for these full-time, and sometimes reduction in tuition.
That's good to know.
If you're a MetroTech student, yes.
That is good to know. And I guess at any point, can people start into the stream of these, or do these programs start at certain times during the year?
In the short term?
Yes.
Not in the stream. We are called lockstep. We do the traditional training where a teacher's in the room lecturing, demonstrating. So we have to wait till that class is over, and then we run another one. So probably for the certified nurse aide, we run about 6 of those per year, and then we'll run also in between certified medication aide so that everybody can stay in the loop and continue their education.
Once they contact you, they can find out. And of course, right at the end of this program, once it's put together, will be that information. Yes. And our time has gone very quickly.
Wow.
Lou Wood, Instructional Coordinator of Health Courses. And thank you, Keisha Anglin, for being here as a student.
No
and
problem.
You're doing fantastic.
Thank you.
Both with MetroTech, and we'll have to catch up with you later.
All right. Well, thank you so much.
Thank you.
An expanding diagnostic imaging program at OSU-OKC. We want to talk about that and what it offers to students. And with me is Karen Bubb, who's the department head, Diagnostic Medical Imaging. And Karen, I got through that okay.
You did. All of those big words. Yeah, you did.
Tell us about that program.
Well, the Diagnostic Imaging Department actually has two different programs in it, and that makes up the imaging programs that we offer. One of them that we've had established for quite a long time is our cardiovascular sonography program, or ultrasound. Sonography and ultrasound interchange word-wise. The other one is new to our campus, and it is the Radiologic Technology program, and we teach X-ray as well on that. So those are the two.
Well, tell us a little more. What is the difference when people hear about imaging? How do you differentiate?
Well, ultrasound obviously is going to use sound, so sonography is done with sound, and I'm sure everybody always thinks of pregnancy. They always think of that, but usually for ultrasound, when we do cardiovascular, we're looking at the heart and all of the vascular system in the body, the carotid arteries, aorta, everything, and we teach that. So the cardiovascular ultrasound program is done with sound, ultrasound. The radiologic technology program, it teaches basic X-ray technology, and we also are offering a bone densitometry as well in part of the curriculum. When a student comes out of there, they will be able to take their boards because it is an accredited program as well, and they learn to take X-rays, and when they get done, they will have a good foundational knowledge of CT and MRI and all those other modalities.
Yes, I was going to say those are important.
Yes, they are. Yes, they are.
And how is the technology expanded as time goes along?
Well, it's like a smartphone. You buy it, and then the next year they have a newer model. And so the imaging programs that we have the newest state-of-the-art technology that's available to us right now that we teach with. We try to keep the students on the cutting edge of technology, and so we work hard to obtain high performing equipment so that when they graduate, they're used to using the newest technology out. We also teach them some of the older technology as well. But again, usually the life of an imaging system, whether it be an ultrasound system or an X-ray system, is between 5 and 10 years. The majority of them have like a 7-year life before you have to replace them and upgrade them with the newer technology.
And sometimes isn't that time even getting shorter?
It is. And then again, if you equate it to your smartphone, you get one, and then the next year they come out with something bigger and better, or smaller and better, whichever. So.
But that is great. So you have a coordination with the end folks who are going to be utilizing them as employees to keep you updated on what needs to be there.
We do. Both of our programs, we depend on our advisory board members, and we have an advisory board that are on for both of our programs. Each program, we bring in what we would call the experts in the field. We invite them to become part of our advisory board. We value a lot of their input because they have that technology that they're around and they know what's up and coming. And of course, we have to keep up to date as well as the instructors.
Let's talk about a little bit about the courses. What are the length of the training courses?
The cardiovascular sonography program and the radiologic technology program are both 2 years. That includes prerequisites. So some students already have some of the prerequisites. Once they are accepted into the program, there is a pretty rigorous application process, and both of our programs are very competitive. There are a lot of students that want to get in, and so we have an application process that we have to get them through in order for them to be the final selected students that we bring in. Once they're in the program, it's about 18 months after they've been accepted.
So there are certain prerequisites that you're going to filter through and make sure that they are up to level on.
Exactly.
In order to go into the program.
They have to have a really good GPA, and then they have to have their core classes. For any degree program, usually you have to have core curriculum: English, math, science, physics, psychology, some of those different classes.
Let's say someone wants to apply and they find that they've got some deficits. Can they go through some short OSU classes?
They can.
To pick up those prerequisites
Yes.
and then apply?
Yes, and we actually encourage that. During the application process, they actually, if they take their classes from our university, then we award them with a few more points that are applied towards their application. And so they will earn a little bit more point-wise, so that we will consider their applications maybe over somebody who is coming in without those prerequisites.
So it can be a one-stop center for advancing in that area. And also what I'm seeing here is a growth factor. What were we talking about, 26%?
26%, according to the Bureau of Labor and Statistics, and those are the 2016 numbers. Sonographers and sonography professions of themselves they are increasing 26%. They're up to, I think, year 2020 or 2024. They're expected to increase that much.
How many are you able to put into your class size?
Well, it is driven by the number of clinical sites that we have available to send our students to. We teach them on campus, both programs. We teach the didactic work on campus, and then we train them in our labs. We have specialty labs. We have a radiologic technology lab with digital x-ray equipment, and then we have a sonography lab with several imaging machines there. Once they learn that, they have to go out into the clinical world and literally tag along, if you will, behind a certified person that is able to do those. And so the number of students depends on the number of clinical sites. Currently, we accept 20 students a year for our cardiovascular sonography program, and we're planning to accept 20 for our radiologic technology program as well.
And this can lead to a very nice income.
Yes. It's an Associate of Applied Science, and what the Bureau of Labor and Statistics show is that for a sonographer who graduates from a bachelor program and an associate degree program, the hourly rate is only $1 more an hour for a bachelor's than an associate program. But if you do the math, they had to go 2 years longer and to get that degree if they do a bachelor program. And they're not really being compensated on the other end of that because they're only making another $1 an hour for a bachelor's program. That's on average. There are some that make more and there are some that don't. So once a sonographer or a rad tech or radiologic technologist graduates and they become certified, obviously it's going to be based on years of experience. And so currently the students starting out are anywhere between $52,000 up to $70,000. It just depends on what they're doing in the field. That's for sonography, and the radiologic technology is about the same, a little bit lower.
So we're seeing in society the marketability of a degree is becoming more and more critical.
Yes, it is. It is. We used to, for our radiologic technology program, the accrediting body, which is called the American Registry for Radiologic Technologists, they used to accept students from technical trade schools that did not come in with a degree. They are no longer doing that. The students that they will allow to sit for their certification boards have to have a minimum of an associate degree, and so they're really steering them towards obtaining degrees.
Which is perfect because that's what you offer.
That's exactly what we offer.
And I'm looking here at outpatient clinics, doctors' offices, hospital. How many sites are going to need this person?
Yeah. Well, I received a call yesterday, and I get them all the time that they're looking for students to graduate. So what I do is we have a little program a little part of the program where I have them write their own resumes, and I actually tell them I want those resumes because I want to be able to hand them out to people that are looking for those particular people. And last year, our graduates, we had 14 graduate last year. We had a smaller class, and all 14 were hired within 3 months of graduation. We actually had some that were actually hired before they graduated. Those are our sonographers, our cardiovascular sonographers. This year, we have 17. We started out with 20, and with attrition, we're going to graduate 17 this year. Out of those 17, 5 are already employed, and they haven't even graduated yet. And so I'm looking at, hopefully by 3 to 6 months, the rest of them will be.
And more of these locations, like an outpatient clinic or a doctor's offices, they're constantly enhancing and putting more technology
Exactly.
into those, because at some point years ago, they probably wouldn't even have some of these services.
They didn't. And the way medicine is, it's really becoming specialized, and the more diagnostic opportunities that you have to give to a patient, that allows the physician to better know what's going on with that patient and give them better care. And so they bringing them into their offices more, and it just gives them a better opportunity to give better patient care at the end.
How long has this associate program been available?
For the cardiovascular sonography, it's been over 10 years, and recently we're really proud of this. We were named, and I can't remember the site, it's slipping my mind, but there are about just under 300 accredited sonography programs that offer an associate degree in the United States. We made the top 20 this past year, and actually we made number 11. And so we were pretty proud of that. And they based that on our graduation rate, our job placeability, and our attrition rate. And all of those were really high numbers, and we were really honored to be in the top 20.
It doesn't surprise me.
Thank you. And you're at OSU.
Well, I taught there for a number of years.
Yes, that's fantastic.
Excellent facility. Mm-hmm. And let me ask you this: what was your journey to get to where you are now and what you're doing?
Okay, I am a career sonographer and radiologic technologist. I am actually certified in both of those areas. The radiologic technology has a special certification, and then I have different certification for the sonography program. So I have over 30 years of experience out as a diagnostic imaging professional. I began teaching at OSU as a lab coordinator. I helped them learn some of that, and then as the department had vacated that role, I took on that role, and we have just been growing leaps and bounds since then. It's been a great transition.
Let's say people are watching now, and I guess you get all age range coming through. What would you suggest that they look at and think about to see if this might fit them?
Well, we have other programs, other health programs. We have nursing, and we have paramedicine, and we have healthcare administration, and we have nutritional science. We used to call it dietetic technology, but it's nutritional science. And I think it depends on the interest of the person. My mother and my sister are both registered nurses, and I adore nurses. I think they're great, and God bless them for being nurses, but I know that I was not interested in doing that. There was something more. I was more technical oriented, and my father was a geologist, which I got part of that on my end. And so I was more interested in the technology and the hands-on, the equipment, what we can do with that. And I think that it's more appealing to somebody that has that technical mindset.
And that's a good insight, and I'm glad you shared that with me. Our time is gone. Okay. Karen Bubb, the Department Head Diagnostic Medical Imagery, OSU-OKC. Thank you for being here.
Thank you. I appreciate it very much.
At Francis Tuttle Technology Center, the flexible healthcare program they have makes available to working adults the ability to take classes leading to certification in healthcare while working around their life schedules. That is so helpful. And we want to talk with Shelba Murray, who is the Adult and Career Development Specialist in Health at Francis Tuttle Technology Center. And I know I should have said Shelba.
Yes.
So I got it right.
Yes, you did.
Yes, let's talk about this program.
Thank you. Flexible healthcare, it was developed to meet the students' needs where they're at. Traditional healthcare classes and short-term offerings have been dictated as certain days and certain times. And a lot of our students can't meet those dates and times because they have other commitments with their families or with working schedules or maybe other school schedules. So the flexible healthcare program allows them to come to school and go to the classes they need for certification on their own time. They meet with the instructor and determine what their schedule will be, and then they attend the class to meet the certification requirements.
Well, these aren't one-on-one training. There are several of them, I guess, that get together at that time.
There are many students in the classroom. We have 6 different classes going on in one classroom. I typically have 3 instructors in that classroom at the same time. It's a self-paced, self-directed classroom, and students are doing independent study with teachers there to guide and instruct them as they need to.
Are many of these mid-year? By that I mean they're not young, they're older individuals re-careering?
A lot of them are. We have students who are coming in and need preference points for different college classes. For instance, they're going to go on into nursing. We've had pre-med students because they want some experience in healthcare before they go that direction. And then my oldest student has been 78 years old.
All right. I had this long pause, but I absorbed that. That's wonderful. That's wonderful. Now, what about the combination of some classes go with some online, some in class? Do you combine any of those, or are they all in class?
All of our programs in this flexible healthcare program are in class time because our state certification is met by the Nurse Aid Registry dictates that they have class time. They don't have the option to do online or at home, those kind of things in this particular area.
Right. Let's talk about some of the programs that are listed that are mentioned on the Flex Time programs. Okay.
We offer the Certified Nurse Aid, which is 102 hours. The Certified Medication Aid is 60 hours. And then we have the updates that go along with those, which are refresher courses for those already in the profession. And we have medication administration techs. We have home health aid deeming classes, and then we have some Certified Medication Aid advanced courses for those that want to have a little bit higher level of care given.
And so how will a person get into the stream of one of these classes? Just call and see when the next class starts?
The class is ongoing. It runs year-round. We only close at Christmas break. And so a student will just enroll in the class, and as soon as they enroll, they're ready to meet with the instructor and set up their schedule.
That sounds awfully flexible.
It is flexible, and it meets the students' needs.
That is so outstanding. How did you get into this field?
Into the flexible healthcare field?
Well, and just into the healthcare field.
Oh, into the healthcare field. Well, I had wanted to be a nurse since I was a child, and as I said, playing with my brothers on both sides of me were 2 brothers, and the only way they'd let me play Cowboys and Indians or Army with them was to be a nurse. I had to fix them after they got shot.
Oh, so when they got seriously hurt, you were there for
I was
them.
there. And, I've always wanted to be a nurse. I've always enjoyed helping people, and I still find this career exciting.
It's so exciting also to me over the years to see how much more flexible technology is getting, the centers are getting in allowing this type of flex training.
Absolutely. We really do have to meet the students' needs where they're at instead of always having the type of training that has been regimented and in an institutional environment. We really do have to go where the student is and meet their time schedules.
And you've been involved in this long enough, you've probably seen some of this evolution happen.
Absolutely. We used to only meet on Tuesdays and Thursday nights, and now we can offer it at any time, days or nights.
And what difference are you finding now in the lives of students being able to have this kind of a flexible opportunity?
Well, I find that our students are we're seeing a more self-directed student, a student that really wants what they want to know coming into the classroom, as opposed to someone coming because that's all that's offered. So we see people that are really variant in the classroom.
And what is the history of doing this? How long have you had the open online schedules?
We've had the flexible healthcare programs in place for 4 years here at Francis Tuttle. They started, to the best of my knowledge, at Canadian Valley Technology Center many years ago. Probably as long as 10 years ago they started. So they've been in existence for a while, and we've been fine-tuning as we've gone along and have come up with, I think, a very good program.
So have you seen an evolution even in the last 4 years as far as the interest in the program?
Our program has really grown. We started out with our instructors there in the classroom waiting for students to come in, and now students are coming in every single day. We'll typically take in 2 to 3 students every day.
And so are you having to work with a limit of students?
I have the setting set for 16 students at any given time slot. Our classroom is open 9 to 12 and 1 to 4, so if a student wants to come in 1 hour a day, they could. But I have not yet had to turn a student away. We've always been able to meet the student's need because they have such a different need for each other that it never has conflicted yet.
With some of this training, you have the theory, the didactic, and then how does this incorporate into the hands-on on some of these?
Within our classroom, we have the actual classroom setting with seats and desks for the students to learn from, with the computers and the videos and all that going on in the classroom, and it's connected within the same classroom with a sliding door that we can pull to for noise, with a lab, a 2-bed lab that we do all of the skills right there in that same classroom. So the students are very fluid in going back and forth as they need to. When they're ready for a skill to go along with that theory, then they just step right over into the lab and the instructor works with them on their skills.
In these particular programs, do they also do on-location real-time training at different facilities?
They do. They have to have clinical time, and we take them out to a clinical at the appropriate time in their course of study. Typically, we go to clinical every 6 weeks.
So all of this is over what time frame? What are the length of the courses?
Well, our longest program, which is a nurse aid at 102 hours, they have 12 weeks to complete the program, 3 months. Most of our students finish in 6 weeks for that program. But our students who have the shortest program, which is a 4-hour program, I've had some students take 2 weeks to do that one. And other students can come in and finish it in a day. So it just varies.
I think what I'd like to at this point is ask you about some stories, some people who've gone through this program and what their responses have been to being able to have this flexibility and how it's helped them to be able to be in the program and to achieve in the program.
Okay. The one that comes to mind as my most recent success is a young man who had been in actually a healthcare industry, but in a data setting. And he had been laid off from his job. He's an older student, had been laid off, and had wanted to go back into healthcare because he enjoyed working with people. His frustration was that he has dyslexia, and he was very concerned about being able to go through a program to do all the knowledge base that has to be done to meet the needs. So he came to our program, we visited, he told me about his concerns and his fears, and we went down to the classroom with him, showed him how the class operated, how he could work on those programs on his own, at his own pace. And he would work through the videos as he needed to. He would go home at night, and his wife would help to read to him also from the book. So then he'd come back to the class and study again the next day. And he did finish that program and became just recently certified as a nurse aide, and is excited to be out there working again, doing what he loves to do.
Because at first perhaps he was wondering, is this going to be insurmountable?
Absolutely, absolutely. The beauty of a program like this is that we have students who can run through a program very quickly. Maybe they're, like I said, we had a pre-med student, and it's very easy for them. And then we have those other students that need more time, and they can hit that bump and take the more time they need, and it doesn't mean anything. It just means that they just get to learn it the way they need to learn it.
It sounds to me like you're incorporating a lot of soft skills in the way
Absolutely.
that you're working with students to help them make the tie-in that they need to attitudinally into this.
Yes, we are. It's very important that our students really are understanding of what it is that's needed in the healthcare industry. So we try to tie everything we do, even to their clocking into the classroom, as job related, and making sure that they meet all of those requirements as well as the hard skills that they have to learn.
What about another example? Anyone come to your mind? You know, I ask that a lot of times because it helps us make this a real life situation.
Sure, absolutely.
When we talk about
our 78-year-old gentleman that came to take our class.
Oh, I'm glad you're going to talk about that.
It's very interesting. He has a sister who was opening the transition has been to different types of long-term care facilities now. And his sister was opening a home, which was a 4-bedroom home, and you see a lot of those coming in now, licensed as long-term care. And he wanted to be able to work there as a nurse aide to help her. So he came in to take the nurse aide class. And he was very concerned about being able to do the skills that were needed to be done. But truthfully, because of the machinery and things that are there available now for our nurse aides, they don't have to do all the heavy lifting they used to. And he's able to do that. So he has come back now and taken 3 other programs through that program with us. And we say it's because he loves our instructor, but I know it's because he enjoys what he's doing out there.
That is an amazing story of and by itself. What does the future hold for these programs, do you think?
I think we're going to see a larger expansion of these type of programs, not just in healthcare, but in information technology, in the transportation trades and those kind of things. We're going to see those programs expand that need to meet, again, the needs of those adult students, because we have a changing world and a world that's moving very rapidly.
And don't we have a demographic shift to where more people who are re-careering
Absolutely.
are going to be coming into this, and they're going to have that flexibility in their schedule.
Absolutely. Absolutely.
Perhaps more courses being flexible in the future.
I think that's the trend. I think that's really the trend we're going toward.
And I think that's exciting because, like you were saying earlier, you can remember when you're there at this exact time,
Yeah.
or you're not part of it.
Absolutely. Yeah.
And the difference that can make. Wow. Well, what would you say to anyone who's watching now? What should they think about if they're wanting to get into one of these?
I think the thing that comes to mind is just be ready to do something new and exciting. Give yourself the opportunity. There are opportunities there for anyone who wants to learn a new career or update their skills or advance in their career.
That's good advice, because some people, they start thinking about this, and so I would call it almost overthinking. Oh, well, I could never do that, or, well, I don't know if I want to get into that, but they just need to take the effort.
Make the effort. Learning is 50-50. That instructor's there to help you, but you're there too.
At the end of this program, there'll be all the information
Yes.
about who they can contact. Well, Shelba, thank you
Thank
for
you.
being here. Adult and Career Development Specialist in Health with Francis Tuttle Technology Center. And who knows, we'll have you back sometime so you can give us an update on this.
Thank you very much. I appreciate it.
Dr. Robert Grupe is...
As we've seen, what a perfect time to get the training and certification needed to enter the healthcare profession. The need has never been greater, and the programs available, they're outstanding.